Good afternoon, as well as good morning and good evening to everybody. My name is Mihaela Ionescu, Program Director in ISA, the International Step-by-Step Association, and you are watching now the Early Childhood Workforce Initiative webinar. The initiative is hosted by ISA, based in Netherlands, and the Results for Development Institute in Washington, and today's webinar is co-hosted together with EGDAN, the Early Childhood Development Action Network. A special welcome to you, all the listeners who are joining us today from all over the world. Before getting on the topic of the webinar, we would like to acknowledge the financial supporters of the Early Childhood Workforce Initiative, thanks to whom this webinar is broadcasted: the Bernard van Leer Foundation, the Open Society Foundations, and the ELMA Foundation. The theme proposed for our today's webinar is a spotlight on the working conditions of the early childhood workforce. In all professions, the working conditions do make a tremendous difference. But what about the early childhood workforce? And we plan to address these 4 questions. What working conditions do members in the early childhood workforce face? To what extent are challenging working conditions a barrier in recruiting and retaining the early childhood workforce? To what extent the working conditions influence the quality of the service delivery? And what efforts have been taken in different countries to improve the working conditions of various categories of the early childhood workers? Our ambitious plan fully depends on our guests. And we are glad to welcome today Sara Bonetti, Associate Director of Early Years at the Education Policy Institute in London, UK. Hello, Sara. Oliver Young, Head of the Private and Public Service Unit at the International Labour Organization in Geneva, Switzerland. Hello, Oliver. Sumitra Mishra, Director of Mobile Creches, and her colleague Neeru Patnagar, Senior Manager Capacity Building at Mobile Creches, both in India. Hello to both.
Hello.
And Kennedy Orenjo, from Country Director of Health in Siaya County in Kenya.
Hello.
Hello, Kennedy. Hello.
Hello.
Before starting our discussion, I would like to mention just a few things regarding the way we will spend the following 70 minutes or so. We prefer the dialogic format with the slides accompanying the discussion. A few questions were prepared, as you saw, in advance, and we shared them with all of you. We foresee like 10 to 15 minutes of discussion for each of the 4 questions. We thank to all of you who have sent in advance questions, and we will try to answer them during our dialogue. In case we do not manage, because we did receive a lot of questions, we will answer to them in writing and post the document on our webpage, on the website of our initiative under the webinars webpage. If you still would like to submit questions, you can type this directly in the questions panel that you can find on the bottom right side of the screen. And we will also try to address them either during the webinar or, as I said, by answering in writing in a document. Finally, the recording of today's webinar will be available on the initiative's website, just in case you need to leave early, or if you would like to recommend the webinar to one of your colleagues. Well, before starting the dialogue with our guests, we thought of mentioning that when talking about early childhood workforce, we refer to an ample inventory of professions and to a variety of working conditions. But what do we mean by working conditions? Got inspired by the research brief on working conditions matter developed by the OECD back in 2012. We refer to the wages. We refer, especially in terms when we refer to early childhood educators or home visitors, social workers, the staff child or family ratio, to the maximum group size in case they are working with group of children, working hours, or about non-financial benefits, about the organizational climate, the manager's leadership, teamwork, or workload. All those factors that can influence the ability of professionals to do their work well and their satisfaction with the workplace, work tasks, and the nature of the job. The first question refers to the type of working conditions that early childhood workforce members in general experience in majority of countries. The general consideration about the working conditions are that improving qualifications, training, and the working conditions of the early childhood workforce has been identified by the OECD as an effective policy for improving the quality of services. Emphasis, however, is paid on how to improve the early childhood workforce in terms of increasing their qualifications and training, and less emphasis is given to improving the working conditions of the staff. Also, through the desk review that we have been doing and in the reports that have been developed under our initiative, we just understood that the majority of the professional groups working in early childhood programs, be them educators, caregivers, social workers, home visitors, and other categories of personnel, seem to share equivalent working conditions. Moving to the first question that we tried to address during the webinar, we do find out that many studies refer to working conditions of the early childhood workforce in terms of salaries or the workload or the ratio. And we found out that in terms of salaries, that the early childhood workforce is one of the most underpaid professional groups, and there are great variations in terms of wages across the professions. In USA, in the recent Early Childhood Workforce Index in 2018, at times the wages are so low, it was mentioned, that numbers of staff report food insecurity, worry about housing, and postponement of education and medical treatment. In the country study that we have been carried out under our initiative in Peru, for the CUNAMAS program, although when joining the program, the compensation seemed attractive to regional staff and community actors, the long hours and significant traveling and challenging context, as well as job insecurity, detracted them from the initial appeal. It seems so that in several countries, the salaries might be one of the issues that is concerning one of the working conditions across professions. Oliver, now, as you do represent a very important organization, which is like a watchdog for the workforce rights, equal and equitable treatment, what is the general understanding about the early childhood workforce working condition, especially under the report that has been released in 2014, that's very true, regarding the promotion of decent work for early childhood education personnel?
Thank you, Mihaela, and good afternoon. Hello to everyone. Yes, my name is Oliver Liang. I'm from the International Labor Organization. For those of you who don't know us, we are just today celebrating our 100th anniversary. We're an organization that's part of the UN system that deals with labor issues. And what makes us special is we are a tripartite organization made up of trade unions, employer associations, and governments. And we have a very strong standards-based approach, so a lot of conventions and recommendations. And what Mihaela was referring to, which I believe is available in the handouts, are the ILO's policy guidelines on the promotion of decent work for early childhood education personnel, which were adopted in 2013 by a tripartite group of governments, employers, and workers in the area of early childhood education. So in preparation for developing these guidelines, the ILO held previously a tripartite meeting which explored some of these very questions about working conditions of the early childhood education workforce. And here I think it's important to already make the first distinction. We're talking about education workforce, so primarily pre-primary teaching in an educational setting, although we recognize that early childhood development workers, there's a big spectrum where these could be also included. I think some of these things are not a surprise and have been borne out by more recent research. Early childhood education workers have, in all respects, the lowest status of teachers. Teachers, as you know, are challenged around the world by difficult working conditions and a low status, but this applies especially to early childhood education workers and ECD workers. There are a couple of things that we have to keep in mind. The sector is marked, of course, by a very high level of privatization. So it's only recently that governments have started making pre-primary education compulsory and free. And as a result, a lot of the providers up till now have been private. It is also a highly female-dominated field. In some countries, over 90% of the ECD workers are women, and I think the worldwide average is still in the high 80%. So it is a very female-oriented workforce, and that has many important implications on the way it's perceived and in the kind of working conditions that are then attributed to this so-called female sector. What the ILO discussion bore out was that ECE workers had the lowest levels of qualifications for among the teaching staff. That's something that is still borne out by statistics today. If you look at formal ECE, the percentage of trained and percentage of qualified teachers remains well below those of primary teachers. And as a result, it's difficult to improve the status when the qualification levels are seen as being lower. The same applies for wages and hours of work. Wages are significantly lower in many countries than those of primary teachers. And the hours of work, of course, are longer because early childhood education sometimes is seen also as a kind of child care arrangement, so hours of work extend throughout the working hours. I've already mentioned the gender disparities, the enormous gender rift in the workforce. Opportunities for continuous professional development and career progression are extremely low in this sector, as it is often privatized, and private centers don't offer the kind of continuing professional development or opportunities or financing for staff to develop themselves. Very important factor is also the low level of unionization of early childhood education workers. Many unions, in fact, face the problem that professional teachers have, up until recently, looked down on early childhood development teachers, seeing them not part of the professional teaching force and therefore not including them in their ranks. This is fortunately changing. We're seeing now countries like Denmark, for example, where early childhood educators are forming their own unions and being recognized by other teacher unions as an important force, and are in fact taking the lead on many education issues. And finally, also important is, of course, that early childhood education and development are not always controlled by one ministry. They tend to fall under education ministries, but sometimes also under ministries responsible for children or ministries responsible for women. And as a result, the policy is not very coherent. If we can move to the next slide, please.
Now, Oliver, we will get back to the next slide that you plan to present later on when we will refer to the second question. I just wanted to thank you very much for all the information provided, and I was just wondering, while listening to you, shall we understand that, for example, if there were the qualifications, the level of qualification was higher, would have mean that there would have been better wages, and if there would be more unionization among the early childhood workforce, there would be better chances for a better negotiation, let's say, of the working contracts. Would this be something that you would say if we were to look at possible ways of approaching the issue of the working conditions.
Yes, thank you. It's a bit of a so-called chicken and egg question.
Yes.
I think any strategy to improve the status of early childhood education workers has to move along several fronts. And the first is something that governments can do, which is to recognize early childhood education. And this has, of course, now happened. It's seen as an extremely important intervention, something that requires strong policy coordination and indeed a policy. Such a policy can set out higher qualification frameworks for ECD workers. Our guidelines recommend at least a tertiary degree, if not a something up to the master's level, which is indeed the case already in some developed countries. And this, of course, helps make the argument that these are highly qualified professionals. However, there is a challenge there, and then we have to recognize that in many developing countries, ECD and ECE workers are people who are doing the work on a volunteer or on a informal basis. They may not have formal qualifications, but they have been doing the work for many years and might be, in fact, excellent practitioners. And so one of the challenges there is not to set the barrier too high where it discourages many excellent workers from doing that, but finding pathways that allow them to get some sort of training and qualification to improve their status. I think it's also important for unions to do the work and to organize this set of workers, which is a challenge if you have many different private and volunteer and sometimes home-based settings. But this is a challenge that unions face in general as they have to organize the less formal sector. And again, governments can play a role here in protecting unions as they do this work, and also encouraging employers to allow this kind of organization and for the employers themselves to organize so that they can also speak as a collective voice and discuss policy. And finally, if I can add, and this is underlined often, governments and various stakeholders have to work more to get more men into the profession. This breaks the perception that this is feminine work. As it's seen as also a men's profession that can perversely increase the status to some degree, and it can attract more interest, as we unfortunately still live in a patriarchal setting, and often of men to recognize this work.
Thank you very much, Oliver. We will get back to you when we continue our discussion. As you might see now on your desktop, there is a slide that continues the discussion related to salaries. And as I will very soon approach Sarah Bonetti from the Education Policy Institute in UK, we just found in the OECD report in 2018 that on average across countries with available data from 2005 to 2017 reference years, the salaries actually increased by 11% at pre-primary level, at 8% at primary level, 7% at lower secondary level, and 5% at upper secondary level, with an increase exceeded 20% in Poland at pre-primary, primary and secondary levels, and also in Israel, Latvia, Luxembourg and Norway and Turkey. However, I think that this is not the case necessarily in UK, and especially in England, based on the report that has been launched just last week on the 17th of January. Sarah, could you just share a little bit from your from the findings of your report? What's the situation regarding, we are talking about the early childhood educators again, and we are talking about a developed country.
Yes, hello Michaela, and hello everyone else, and thank you for joining us. Yes, so as you mentioned, our report looked into the early childhood education workforce, which applies to everyone taking care of children, education from age 0 to 4, 5, which is the year of transition into primary school. And we have seen for many cases in our report, we found that the situation in England is very much in line with what Oliver was saying in terms of predominantly female, low level of education, even though we are developed countries. We start from a situation where the early childhood education is based on mixed market provision. So we have to keep in mind that we're talking about very different providers types. The maintained or state sector or nurseries in schools usually require the early childhood teacher to have a degree. They are higher paid and have higher status, although still relatively lower compared to primary, secondary, and tertiary teachers, as Oliver was commenting. Then we have a big private, voluntary, independent sector and childminders, which are like in England are called the home-based carers, who usually, not always, but in general tend to have lower qualification level, much lower pay. Connecting to one of the questions that were also asked, sent in advance, in terms of like how to advocate for better condition, and I'm going to refer here to the low average pay. What we did in our report as a way to advocate about better condition and about informing the public how things really are, what we did was comparing childcare workers with the general female working population and primary and secondary teachers. Because there is a lot of conversations around teachers, for example, in England. If we look at childcare workers, like at early childhood workers, we don't have that same conversation, even though we have similar or even more worrisome problems. So we saw, again, like you mentioned, Michaela, that in their case, pay is not just low and much lower compared to the general female working population and teachers, but that pay has decreased by 5% in real terms since 2013. So while the general female workers have seen a 2.5% increase in pay since 2013, that has not been the case for childcare workers. And another big element that we look into is just pay, but like general financial security. We found that 44.5% of childcare workers rely on state benefits compared to a much lower proportion of the female working population and of teachers. So again, this is not in line with what we've seen in the previous slides for what's happening across other countries. Other things I said outline, just like Oliver was saying, is again, we have low qualification levels, low entry levels in the private, voluntary, and independent sector compared to the state sector. And we also have a low and decreasing proportion of staff that are working to upskill. So it's not just a matter of starting low with qualification, but also that because of a series of austerity and financial pressure on providers, they are not able to afford continuing professional development for their staff, and we see a decreasing proportion of them upskilling. And finally, again, back to unionization, qualifications, and comparison with different type of teachers. Teachers at different stages of the education system. There is no compulsory induction outside the school system in England. So even those who have a degree level in early years, there is no compulsory induction for them compared to those that work in the school sector. So all in all, there are a lot of disparities, and yeah, unfortunately, working conditions that have not been improving in the last few years.
Thank you very much, Sarah. We will get back to this report and all kinds of findings related to the questions that we have prepared in advance for this webinar later on. I think that what you have talked also kind of helps us transition into the second question that refers to what extent the challenging working conditions are a barrier, because we have just found out that there are some challenging working conditions related to the early childhood workforce. To what extent they are really a barrier in recruiting and retraining? We found out that across the globe there are calls for finding solutions in order to retain the well-qualified staff in the sector. But this means that there are concerns about the impact of the high workloads, the level of stress, and the poor working environments on professionals themselves, but also on the quality of their work. Now, We have also learned from the Global Social Service Workforce Alliance that the retention of the social service workforce also is a challenge in both developed and developing regions due to low salaries, high caseload, low professional status, partly shaped by cultural views and lack of resources, and even issues of burnout and secondary trauma. I wanted to mention this because we are talking about the whole range of professionals that are involved in the early childhood services, not only the early childhood education sector. And this leads us to the question, I'm coming back to you, Oliver, that you wanted to refer to the second slide that you have prepared. Coming back to the early childhood education workforce, I wonder to what extent, what should be the priorities in terms of preparing and recruiting as well as deployment of the early childhood education workforce. What were you, from the report, for the guidelines that your organization released, what would be the priorities that should be followed in the next period and after the report has been released and in the coming period also? Oliver, you might want to unmute yourself. Are you still with us?
Yeah, sorry. I think you had the power to mute.
Yes, okay.
My wife would dream of that. She can turn me off anytime. So thank you. Thank you for the question. I just wanted to, yes, I mean, working conditions and employment conditions are very important areas, and they certainly, to improve those, there's many steps we can take. I want to get back to something that was just said by Sarah. There seems to be this very weird phenomenon that you have, everyone recognizes the importance of early childhood education in ECD, yet somehow no one is prepared to pay for it or to recognize the professional level that's needed by the practitioners. And there is an issue here that it's a bit of an elephant in the room, but I'm going to raise it, which is that often ECE and ECD are seen as also childcare solutions. And unfortunately, and it's in fact promoted as a means of childcare and as a means of, for example, getting women into the labor market by giving them the time to work. And unfortunately, that is a conflicting interest, because there is research that shows that decisions about childcare are often based on price, where you have, whereas education, which has been hijacked by this very results-oriented testing and grading and so forth, where teachers are now positioning themselves as professionals who can deliver these important results to your child's future, ECD is still seen as a sort of, well, it's a good place to park the kid while the parents work. And so these considerations are, I think, are still pressing down on some of the working issues. Now, in terms of what we're promoting to further professionalize and improve the working conditions, of course, qualifications we've talked about. We already spoke about the tertiary degrees. I think there's some other things that are important. Financing is a key issue, and more public financing has to go into it. The guidelines recommend 1% of GDP. That's certainly not something that's been picked up yet by the international community as a global standard, but is something that we're pushing for. What's also important and is often forgotten is that the institutions that provide the training for ECD workers need to also be of a high standard. And so getting good standards for the training institutions, having good working conditions for the trainers, and having qualification requirements for trainers is also important. Making sure that training involves apprenticeship, involves practical work, involves opportunities to work in centers. I think and it's already mentioned in your background work, the rural-urban divide, and making sure that these things also cater to indigenous communities and vulnerable communities. It cannot be underlined. It is in those very settings that and research has shown that the interventions of early childhood education are actually much more impactful. One of the things we recognize that, at least in the developing world, ECE is still very much a middle-class phenomenon. It tends to be urban. It tends to be families that can afford it. So the impact it is having on these families is actually less, since they have so much more access to other things as well. And those that would massively benefit from this are the least served. Some other issues just to talk about: background checks and vetting. Of course, there are security issues regarding to children that cannot be overlooked, and that is something that these schemes need to be well designed. We found that induction, I think this is, Sarah mentioned this is very important, because it really doesn't, you want to not have people who only have theoretical training be suddenly put into practical settings without any kind of guidance from experienced workers in the field. So mentoring and induction is certainly important. And then, well, we've already mentioned CPD. The possibility for reflective practice, I think this is something that the unions have stressed a lot. Teaching is, of course, something that can be trained, but it is also to some degree an art that is perfected by giving space to think about what's going well, what's not working in a particular setting. So these are important as well. And then mobility, making sure that people have chances to move around and experience different settings is important as well. Good. And then if I can just address a few other issues. When you mentioned working conditions before, there are other things that need to be considered as well. We talked about pay, and the guidelines do stress the importance of pay being equivalent to at least that of primary education workers. We've mentioned the caseload or overtime. Overtime pay schemes are extremely important. There are ILO standards on this, and this is something that is often overlooked by employers or abused. So making sure that these are in place is critical. Disciplinary procedures is something the guidelines address. This is something that you find often in school settings, is that every once in a while there is a rotten apple. You have to be able to take workers who are not performing and be able to monitor their performance, hopefully in a supportive way that allows them to improve their work and actually gives them feedback. But in some cases, it has to actually lead to a sort of summary evaluation that could lead to dismissal or to other kinds of disciplinary procedures. These are important to have well established in institutions. And certainly we recommend that these are established in consultation with unions, so that there is a perception of fairness and a perception of rigor attached to these disciplines. I won't go into all of these, but there's a few that are very important. One of them is the so-called employment relationship. Again, in private settings, in informal settings, we find that the employment relationship, which the standard being an open-ended contract, written contract. So normally if you hire a teacher, you're supposed to have a contract that establishes that they are hired, and as long as they perform well, they have a job, or unless the establishment closes for financial reasons. A lot of ECD teachers are working either part-time or for limited contracts, 3 months, 6 months, or on oral contracts or other informal arrangements. And this, of course, weakens considerably any negotiating power, any power they would have in front of a legal institution, for example, should their working conditions be abused. Excuse me. Part-time work is very prevalent in these institutions, and this has to also be regulated to make sure that part-time workers are not disadvantaged over full-time workers. We mentioned child-staff ratios. Family responsibility privileges is important. If you have a highly female workforce, it is there's a very high likelihood that They themselves will have children of a ECE age, so having clear policies about if they can bring their own children to institutions or giving them time to care for their families is going to be important as a motivator. Social protection and social security, of course, are also important. It's a young workforce, so they may not be thinking about pension or health or unemployment benefits or disability, but if you are planning for a long-term workforce, these become very important issues. They are often neglected in ECE institutions and as working conditions. And then finally, health and safety and exposure to violence. We see this, unfortunately, more and more in educational settings. There are important health and safety considerations in ECD settings, be it from lifting children to exposure to communicable diseases. And unfortunately, these centers sometimes get involved in family dramas and other kinds of conflicts where there's exposure to violence as well. So this is something that also has to be considered.
Thank you, Oliver. I think that you have created a quite broad picture of many of the things that would have to be taken into consideration when we refer to working conditions. And if we all of us reflect to different contexts we have been more familiar with in different places in the world, I think that all your considerations have made a strong point that it's a very complex, let's say, equation, but in any case shows that not enough has been done to really create a strong motivation and appeal for the early childhood professions in general, with very few perhaps exceptions that are a little bit better than other professions. We will move now to Kenya, and we will invite Kennedy to just share a little bit of his experience as he's leading health programs at the Siaya County level in Kenya. Kennedy, what can you share about recruiting and retaining the community health volunteers you're working with? I think there were many questions among our participants today that were addressed before the webinar, especially related to those that are working as volunteers in such kind of services that are mostly home-based or community-based. What can you share about the health programs you're running in your county regarding the barriers that you find in recruiting and retaining the health volunteers?
Thank you very much, and thank you for bringing me on board. Now, basically, we are looking at the disparities that we have, of course, and moves across the different managerial levels, and specifically I want to speak about the home visitors, whom we refer to here in Kenya as community health volunteers or community health workers. We are really facing some issues when it comes to the certain barriers when it comes to recruitment and retaining, because number one, we should be able to know that these are volunteers, and being volunteers, then they do not get any remuneration after the work that they do on a monthly basis. But I will also want to invite you to look at the kind of work that they are doing as volunteers. These are people who visit households, and when they visit these households, then they look at several developmental domains that are there within the early childhood development and nurturing care model. And by so doing, then it means they have to walk a long distance. They have to get to nearly 100 households within a period of 1 month to be able to collect this data, and also to be able to talk to the caregivers of these children, and of course bring in the aspect of ECD. But there are two main things that, of course, could be an issue and a barrier in recruitment. The fact that they're coming in as volunteers and they're not going to get anything towards the end of the month. And also the other aspect in retaining them is the motivation and recognition that they want, of course, done to them by the various bodies that are coming into contact with them. And this has been a real issue, because there's no clear budget on how to be able to motivate them. That is when it comes to giving stipend or salary in that case, and also how to be able to, of course, reward them by giving them, of course, different ways of recognition. And this has been a real barrier. And of course, that's what makes the attrition rate a little higher, because now many people will opt for going for jobs that are paying to them, and rather not really go in a volunteer aspect to be able to help the community in that case. So that's what I can say about it. And specifically, it is about motivation and, of course, volunteerism as an aspect. Thank you.
Thank you also, Kennedy. We will get back to you with other questions related to the workforce you have mentioned when we will address the other questions left in our webinar. We are moving now back to England to refer to what are the barriers in recruiting and retaining that you have found out also, Sarah, in the report that has been released. You were mentioning also that you have high turnover rates and staffing instability.
Yes, so I'm gonna start by picking up on where Oliver left in terms of government signaling and government funding, because that is very much the big elephant in the room in England. There has been some significant investments in the last few years, but the focus is on childcare to allow parents to go back to work, so on quantity rather than on quality, and that has put a significant strain on providers. And because the majority of the provision is in private, voluntary and independent sector, that turns into significant recruitment and retention issues. We have high turnover rates, and they're much higher in the private and voluntary and independent sector. And then picking up on where I was talking about the employers not being able to afford to provide continuing professional development, we do see a big proportion of the older workforce, which is highly qualified, but they are aging out. They are about to retire in the next 10 years or so. So we will lose highly qualified workforce, and we're not sure that the younger cohorts are going to be qualified enough to be a good substitute, because again, there is very little incentive for workers to qualify on their own time and money. And there is and once they qualify, there is very little incentive to say if they upskill, they want to move into the public sector where working conditions are better. And so we've seen a lot of also other reports from SIDA, for example, that have shown that many providers are recruiting for many open positions, above all for those that are needed to comply with ratios, and they are having a very hard time finding suitable candidates. So it's really a big tension that once again is talked about a lot when it's about primary and secondary teachers, but not enough when it is about early childhood education workers.
Thank you, Sarah. We will have to move ahead by having introduced our discussion, inviting our guests from India, just to talk also of the same topic regarding the barriers in recruiting and retaining the early childhood workforce, as we can learn from the mobile crashes experience of 50 years of operating on Indian territory. Sumitra, please do come in with answers regarding the long experience that you have accumulated and how much the barriers are really a problem that has to be addressed when we're talking about early childhood services in India.
Thank you, Mihaela, for giving us this opportunity. Yes, 50 years is a long time of working on the ground with the young children on training early childhood workers and right up to the policy level influence that we do. So when both Neeru and I will speak about our experience, we are looking at the ECT workforce as those working for children from birth to 6 years. But in some of the very difficult settings where we work, these workers are also working with children as old as 8 to 12 years. In terms of the main challenges, I mean, a lot of it has been addressed by Oliver and Sarah, and also earlier by Kennedy. But I think the basic systemic barriers that we face in recruiting and retaining workers is that there is simply no recognition of care as a professional cadre of workers. Women, men do not see this as a professional workforce. It's very closely associated with the issue of women's care work, which is supposed to come as an inherent quality amongst women, which is why there is no recognition that there should be professional training and support to these care workers. But that's and of course that leads to the low salaries, the low no systems for wage increment, and of course no recognition, rewards and appreciation, because there's no recognition of this workforce as a qualified professional cadre of workers. So that's at the first systemic level, but then there are also additional barriers to in how it affects women or men from taking decisions to join the workforce, and those are related to the cultural and physical barriers that Neeru will speak about.
Hello to all of you, and good morning and good evening, wherever it suits to you all. I'm going to talk about cultural and physical barrier, and Sumitra rightly said we are going and talking on the spectrum from birth to 6 years of age. And what we found is, like, and we know, like, early childhood care includes a lot of cleaning, washing of young children, and which is at times considered as a very dirty job. Therefore, what happens is the professional and the qualified staff or the workforce doesn't want to enter into the childcare and take it as a profession. And in case we are able to recruit them also, it's very, very difficult to retain that kind of cadre with us. So we usually left with illiterate or semi-literate people or the workforce. Apart from that, as even Oliver said, and Sumitra also shared, that childcare is considered as a very less professional job across the country, across the world. And ECD workforce in India also is dominated by women with low status. And as we all know that India is having a gender inequality in it, and care work is perceived by women, which is less remunerated as well as less respected. It's again a major challenge, especially to recruit qualified professionals for childcare. Long distances, yes, it's a major physical barrier. Mobile creches has been working at construction sites for so long, and construction sites with migrating population. And since these construction sites are moving far away from central locations, what is happening? These workforce and childcare workers need to travel long distances where there is lack of transport facility, as well as if the transport facilities are available also, they are not safe for them. So again, it's a challenge to recruit the people who don't want to take into getting into risk of their lives getting into that profession. Next slide, please. Yeah, the physical barrier again is like childcare provisions are in India, it's usually provided in the poor settings where there is lack of provision, there is no infrastructure, there is no electricity, even basic amenities are not available. And moreover, there are no toilets for women who are entering into these and working at their workstations. So we found that it is a major pushback for these women, and they don't want to come into this kind of profession. And it's again a challenge where there is no safe environment, no transport available. It's always difficult to retain young members, and we usually left with illiterate and the semi-literate staff with us. Thank you.
Thank you very much, Neeru. I think that we have covered now a kind of broad range of content, and I think on a continuum, I think that we could consider many early childhood systems positioning themselves from quite challenging conditions to more privileged conditions. I'm just trying to see what is happening because there was a huge sound in the background. Okay, we are going to move to this question number 3. We have addressed the topic of the working condition very much, from the perspective of the individuals working in the field and working in the system, and their well-being and their self-esteem and reputation. But we are wondering to what extent these working conditions are also affecting the quality of the services, especially when we talk about early years. Quality does represent a fundamental responsibility towards young children and their families. especially given their long-lasting impact that they have on child's development and further success in life? Well, unfortunately, it seems that there is too little research actually focusing on the working conditions for the workforce and its correlation with the quality of services. However, there are a few of these studies, and one is the one mentioned earlier on the OECD, engaging young children lessons from research about quality in early childhood education and care, the Starting Strong, published last year. And there we could find that there is a positive association between salaries, the center's organizational climate, and the staff-child interactions. But the number of studies that have included these aspects is somewhat limited. There is preliminary evidence that suggests that provision for higher paid staff and more team collaboration in centers for children from 3 to 6 and for children under the age of 3 provided higher quality staff interactions. Also, the country study that has been developed under our initiative referring to the Kunamas program, home visiting program, was also mentioning that home visitors have heavy workloads which affect their effectiveness and the quality of their work. So I'm now turning to our guests in the webinar today, especially the with a more country perspective on answering to the question, like what they have understood as having impact on quality in terms of working condition in the programs that they are running. And in England, the case will refer Sarah from the findings in the report. First, we go to Kenya and we ask Kennedy, especially because working with the volunteers is something that can create a lot of challenges. To what extent the quality of their work, Kennedy, is impacted by the working condition? What you have found out as being one of the key, let's say, working conditions that are affecting their work?
Yeah, thank you, Mary. Again, I think the conditions that influence the quality of service delivery, of course, at community level, specifically working with the community health volunteers, is of course the thinking that basically they are in job is it secure in a way, because there are no clear policies and guidelines regarding the training, and this of course is an aspect of really delimiting them from career development away, because a community health volunteer would of course also be thinking of one day also becoming somebody who can be employed within the government system and even earn better pay, but there's that limiting aspect because there are no clear policies and guidelines for that particular kind of transition to the next level, which will be an employment setup. This also will, of course, limit their decisions when it comes to improvement of course, care and service, because in this case, they feel inferior in a way, and they feel that they're not protected by law in the particular kind of exercises that they're carrying out in, of course, checking the developmental domains of these kids, and also being able to assist their caregivers in, of course, caregiving of these particular kids. And then the other bit was, of course, on career development and aspect of distance. In this case, there's that feeling, because in Kenya, the setup is that the physical environment is that you will, at different villages or different geographical locations, find a household that is far away from the next household. So it will like force you to walk like a mile or so to be able to get to the next household, where you'll be able to get a kid and also give the services that are required for early childhood development. So that this distance, the physical environment, at times becomes a barrier when it comes to an aspect of working condition that influences the quality of service delivered, because at times they will get to a household when they're already tired, and of course it's also running late, and being the aspect that they are volunteers in this case, then they'll also be having some other interests or other things that they need to do at the household level. And I want to just echo what Oliver said, because most of these volunteers per se are women in that nature, and they will really in an African setup, then we'll have a lot of work to be able to do at home, and this delimits, of course, the time that they should be spending outside, of course, delivering these services to the community members. Thank you.
Thank you also, Kennedy. We're moving to England again, and we will see to what extent the working conditions are impacting the quality there. What were the findings in your report, Sarah?
So again, as I mentioned before, the increasing costs in the last few years without an increase in funding, I think the number one consequence is, again, is about the high turnover rate and instability. And this is true particularly for staff at level 3 in England. That's the staff that is necessary to comply with ratio, and that creates a stability in the classroom. And we know that a strong relationship between child and teacher is important for children's development. That is definitely has a strong impact on quality, on stability in the classroom within a setting for children and for their family. We've also seen in previous reports that providers are increasingly relying on unpaid staff. Like in reception year, which is the year before the first compulsory year of school, which is a big transition in England, 16% of the staff is unpaid staff. So we really are seeing this race to the bottom in terms of like qualification levels and working condition of staffing. And finally, we have this increasing amount of expectations for early childhood educators to take care of mental health of the children and of their families, and but there is no connection and no training, but no connection with the health and mental health sector, and no training to tackle lots of these issues.
Thank you, Sarah. Sumitra, what is the experience in the mobile creches regarding to the quality of services? What actually, to what extent the working conditions are really affecting the quality of their work? Or which actually of the conditions are actually the more critical ones?
I'm going to pick the cue from where Sarah mentioned about this increasing expectations from early childhood workforce, and that's exactly some of the things that we are facing in how the expectations on our childcare workers is influencing the quality. There is an increasing trend and an expectation from our ECD workers to maintain number of records and registers related to child outcomes, related to program interventions, attendance registers, health records, and so on and so forth. While there is an increasing demand to capture data, maintain data, and keep good quality data, and yet, as Sarah mentioned, there is this whole race towards going to the bottom of the qualification pile to pick up childcare workers. Most of our ECD workforce are coming from very poor level school education, if at all they have a school education, or at a very basic literacy level, and the expectation on them to maintain so many registers and records also affects the quality of work that they do. In addition to that, I must quickly mention that there is a paradox that we face at mobile creches. Some of our workers, on a conservative estimate, have spent at least 25 to 30 years doing this work, and yet we are facing so much difficulty in recruiting young people and retaining young people, and which is why there is high attrition level, the load on investing in their training is high, and therefore that has an influence on the quality. The third thing that I want to mention in terms of how it influences quality is, let's not forget that majority of the frontline workers come from local communities where their own domestic responsibilities are pretty high. So care for their family responsibilities, in addition to the burden of the care work that they do as a profession, influences the quality of interactions that they have with children. It compromises their time and their energy with children, and that in turn influences the quality of the services that we run. Moving on, if I just quickly add on that, can we go to the next slide? Yeah. So because ECD workforce is not recognized as a proper professional cadre, as we discussed earlier, therefore there is less emphasis on investing in their training and their ongoing training and supervision, which means that there is very low opportunity for them to refresh their knowledge, for them to add new skills, and also to bring in innovation to the quality program. The one other thing that we have also experienced, both at the mobile creche experience as well as our work in the public provision system with government and other civil society, is that because the profession is considered low paying, low in status, it has a vicious cycle of perpetuating low self-esteem amongst our workers. They feel inferior in comparison to other teachers and other frontline nursing staff and so forth. As a result, their motivation to invest in their own learning and knowledge building is also poor, influencing the quality of the work that they do with the children at the center.
Thank you very much, Sumitra. I think that we will continue actually the conversation about the Indian context, as we are now trying to move from talking more about the difficulties and the unequitable conditions in which early childhood workforce operating, to more like how these concerns have been addressed in different contexts. What can we do, so to say, knowing all these very difficult conditions and having in mind that the ultimate purpose of all these discussions is how do we act towards addressing children's demands and rights and their families in different contexts of all the countries where children are born. And we need to consider now what are the possible ways, what are the possible approaches in which these challenges have been addressed. And I wonder also now I might invite Niru to talk about the way in which your organization that we have mentioned has a long history of working in the field. How mobile creches has tried to mitigate the risk of losing the workforce, but also to enhance their professionalism and thus perhaps increasing the quality of the services, considering all the difficult situation in which the workforce is operating? Or did these efforts lead to some changes? I know that there is a long way to go, but still, what can you say that have been efforts that did make a difference?
Thank you, Mihela. And yes, surely and definitely there's a long way to go, but over the last 50 years, with all the experiences and efforts, mobile creches have been trying to improve the working conditions for their workforce across all the levels so that we can retain them, we can make them develop, grow, and extract maximum out of them, and so that they can join their work as well as enjoy their work fully. So I'm going to talk about two levels. One is at NC level, what all we have been doing, and also how we are taking our experiences at the policy level to bring changes across the country at different settings and sectors. So first I'm going to talk about mobile creches. As the slide correctly and rightly said, you all can see that mobile creches ensure that all the workforce at their work settings, workplaces should be getting decent place where all the basic amenities are available, say drinking water, electricity, toilets, as well as electricity and everything, and structured room which are more safe in terms of like the strong foundations of the building, because we found that at construction sites it's more sometimes it's a challenge getting a safe pakka structured building. So we are trying to keep that as a mandate wherever we are going, and also wherever we are indirectly going through our partners, we try to meet these all parameters so that the work setting can be having a safe environment. Apart from that, at an organization level, mobile creches adhere to the minimum wages norms for each and every worker. Apart from this, annual increase is also a mandate which is based on the work performances, which generates motivation to deliver quality services. And there is a promotion policy also, which applies to childcare workers as well as to the top, which applies from bottom to top across all the workforce at mobile creches. And in fact, there are some incidences where a childcare worker is being developed and promoted as a center supervisor or an in charge, and later on developed as a trainer also. So there are case studies like that also at mobile creches, which really motivates somebody to join us as a childcare worker. Yes, next slide, please. Next slide, please. Yeah, at mobile creches, our workers are provided with all the social benefits like health insurance, family insurance, maternity benefits, annual paid leaves, retirement support, etc. They feel secure with all these benefits if we provide them. And in fact, here also I should quote that there are incidences where, in case of death or long-term illness of a family, in a family, MC has offered employment to another family member. So it's again a motivating factor for somebody to join mobile creches. Next slide, please. In terms of motivation, recognition, rewards, appreciation, and acknowledgement, which we all know plays a very critical role for employee retention, MC provides various platforms to its childcare workers where we heard them, we value them, and we acknowledge them. They've been rewarded on a yearly basis based on performances, definitely. And MC values for respect, parity, and equity, which are irrespective to the level of workers which are working at mobile creches. And we believe that childcare workers are linchpin of our program, and they are the most important pillar. So we respect them, recognize them, and really award them at each and every panel. And these platforms really helps them, keeping them pushing to perform to their level best. Apart from them, retreats are one of the opportunities for them where we all come together, play together, enjoy together, and have fun. And sometimes these are the holidays, and they are in more holidays mood, which they hardly get a chance within a year to go with their families even. This really helps in bridging the gaps also at different levels. So we are at par with each other and enjoy the relationships across the levels. Next. Yeah. So now Sumitra is going to talk about the policy.
So other than the social and the financial benefits, Mobile Creche also invests heavily in the ongoing training and mentoring activities for its own workers, especially in a cascading model from the pre-service to incremental and refresher workshops. These are, we of course use our own internal master trainers to conduct an ongoing training calendar with our workers, but also from time to time we invite external experts in the area of disability, music, and other innovations to bring to our curriculum and our everyday schedules with the children. The one thing that has helped define and maintain the quality of our services through all these training activities is also because of our 50 years experience, the way we have developed and standardized our non-negotiables as an ECD program, and that therefore helps in defining clear job roles. When a childcare worker joins, the childcare worker knows what is expected out of her, what's her responsibility, and that clarity helps people to keep their motivation, to know their role, and to keep on improving on their role. But that's at the mobile creche level. What do we therefore do with these many years of experience? How do we influence it at a policy and at a larger systemic level? If you go to the next slide, you will see that we have used a lot of this experience of from mobile creches and the work that we do with our partners at various policy platforms. Of course, one of the very strong things that we demand with decision makers is to recognize childcare work as decent work with minimum wages, recognition, and reward benefits. That's been an ongoing campaign that we do at national and state levels. Of course, because of our experience in establishing minimum norms for quality, we are also able to recommend to the Apex training institutes what a training course can look like, what should be the minimum eligibility, what could be the ratio between their practice and their theory classes, what kind of supportive supervision models can be developed as an ongoing part of the training program. So it's not just demanding the service, the training quality, but it's also providing recommendations based on our experience and how this can be rolled out. Next, please. Of course, when we are recommending good practices in the training, we are also backing it up with our collaboration with the government. We work within the government systems in implementing some of these trainings, and in the implementation of these trainings, we focus very clearly not simply on the skill building of the childcare worker, but the importance of knowledge and rationale about quality ECCD care, and also about the attitude of the child childcare workers, which we've talked about frequently from the beginning of this session, how attitudes and culture is pulling back the ECD workforce retention and its influence on quality. So a lot of emphasis is paid on the attitude building, and this we do in our demonstration sessions with a government. Of course, demonstrating best practices within the government system is something that we are doing, and then we are helping the government and the decision makers to look at the costing of these best practices and to prove that these are scalable models and they have been costed within the system. So something for us to keep pushing for when we are working with the government. So inshallah, as they say, one day we hope that the government will take it on. Can we go to the next slide, please? And finally, of course, what we believe is that the low premium, as Oliver said, in the training investment on ECD workforce is due to the low understanding about what good quality early childhood service looks like. We try and use all possible opportunities and levers to raise awareness about good quality services, the rationale for good quality services. And here I must bring mobile creches engagement in the private for-profit sector, where the recently enacted Maternity Benefit Act, which mandates creches and daycares for employees in the formal sector, has given us an opportunity to build a profile of a good quality ECD program, and hopefully the spin-off will come to the public provision, also to the standards and norms in public provision, which will affect early childhood services in the unorganized or in the informal sector.
Thank you so much. Yes, thank you so much to both of you, Sumitra and Niru, for this fantastic overview of the long-term work that mobile creches has done in India, and to the impressive work that you have done to really influence the policies, which I think that at a certain point would really break through with the strong foundations laid by the programs you have run for such a long period of time. We move to Kenya, and we would like to learn from Kennedy what measures have been taken, or what are the intentions, what are the plans to address the working conditions of the community health volunteers in the county of Siaya that you're leading as from the part of the county government. Kennedy?
Thank you, Mihaela, and thank you for bringing me back again. Now, in Kenya, we have this devolved system, and we have 47 devolved county governments, and Siaya is one of the 47 devolved county governments. And within Siaya, then we also have our own county assembly that, of course, debates and comes up with, of course, policies that will be able to guide our activity and, of course, interaction of both, of course, the national government and the county government when it comes to health. Now, health in this aspect has been fully devolved at the county level, and that means that the county then has to make decisions on how health is run within its locality and to be able to provide quality of services to its people. Now, the particular kind of efforts that we are carrying out as a county is that we already we formulated a bill that is a community health services bill. And this community health services bill really looks at the community health volunteer as somebody who should be looked at as a worker for that particular aspect. And if that bill goes through the county assembly, it's currently under discussion. So if it goes through the county assembly and it is passed, then we're going to have a legal document that, of course, will be able to support the payment of stipend to the community health volunteers, and also a document that will be able to talk about their working condition in a more clear way, so that they're able to be incorporated in all the particular benefits that they are going to have as home visitors in that case, while carrying out their ECD work at the household level. So this is an effort that is also being picked by the national government, now that is Kenya as a country, begging from what we've been doing, the reading from the script that we've been doing from the county of Siaya, whereby there also a bill that has been proposed at the National Assembly for the Parliament to be able to discuss, and also if it sees the light of the day, then it can be utilized to be able to, of course, source for resources and funds that can be able to help support this community health volunteer when it comes to, of course, motivation in terms of salary, and again, clear recognition in the way that they can be able to be rewarded for the work they do on ECD. There's also the aspect of capacity building of the workforce and support on the day-to-day activities that they carry out. We currently have a clear guideline on and curriculum on training of community health volunteers, and they normally do a 10-day basic training, and this is a must training for them, with a 1 extra day that they carry out the practical sessions. And within these practical sessions, they're able to go to the households and also visit and, of course, recommend certain elements of developmental domains in children when it comes to ECD. And they also have a refresher program for, of course, 5 days of that particular training. And, of course, other technical modules, around 14 technical modules, which, of course, one of them is dealing with the child health and child survival. And this basically also skews in their efforts and also their decisions when it comes to, of course, development of this child, and that is an aspect of nurturing care as a model. Now, with this capacity of the workforce, then they'll feel empowered, and when they feel empowered, then they have that confidence to be able to carry out, of course, the activities that they carry out at community and household level, with more vigor and, of course, more knowledge on how to be able to create change at that level. Next slide. Next slide, please. Yeah.
This is the next slide. Yes, but the continuous monitoring and assessment, how you still support the workforce.
Thank you, thank you. Now, there is also continuous monitoring and assessment of the programs. This is carried out through supportive supervision. Just like I'd explained much earlier, is that we have different managerial levels, and in these different managerial levels, there's support supervision that is carried out from county level to the sub-county level, which is a mid-level management unit. And then there's that supervision that is carried down from the sub-county management level to the community health assistant, who is now the direct supervisor of the community health volunteer. So when they visit the community health volunteers, then they feel more empowered. And when they are more empowered with that particular continuous monitoring and assessment of the program, then they feel that they are able to conduct this particular activity. Because what we found out clearly was that they are ready to work as volunteers at that particular level, but the need that they have is, of course, a capacity need, and also an aspect of coaching and mentorship, whereby they can be able to be mentored on a day-to-day level so that they're able to carry out the activities in the more required way. The other bit, of course, is on, of course, continuous quality improvements. After conducting after doing this monitoring of the day-to-day situations and assessment, then we normally come down with them to look at the data that they develop and of course mine from the households that they visit, where they normally, of course, provide the ECD services and other services at household level, and then look at this data and look at how we can be able to improve it, and of course make it data that can be relied on when it comes to decision making as an evidence. And through this, then we conduct data quality audits, and within the data quality audits that of course are done periodically. At times they are done on a biannual basis, and at times they're also done at of course a quarterly basis, and this could help us come up with, of course, performance improvement plans that will help these healthcare managers who manage the community health volunteers to monitor the improvement. And this is an exercise that is carried out by the two of them, the community health volunteer also contributing much to this, so that when they are part of the performance improvement process, then they really give it the particular kind of vigor and effort that it needs, so that we're able to improve on that particular sustainable scale. So this, when there's that kind of improvement, then this is now taken down to the community through a social accountability forum, and we refer to this as a dialogue session, whereby now the community that these community health volunteers serve in cases of ECD, then are also given that chance to be able to open their voice on the particular kind of services and quality of services that they are rendered by the community health volunteer. And with this, in a dialogue format, then they come up with action days, which are also means of improving services and service delivery at that particular level, and also as a means of strengthening community health services, and of course the reporting system that is of course done on a monthly basis using different reporting tools for community health volunteers, where they report also on aspects of developmental domains when it comes to ECD. So thank you so much, and that is putting in this account.
Thank you very much, Kennedy. I think that we have heard a lot about how not only to recognize how important it is not only to recognize the work that the volunteers are carrying on, but also to learn about how they can be supported, how they can be empowered, and how we can increase their participation in the community's life, and how they can influence by having a voice in the community's decisions processes. Sarah, we will just turn now briefly to you, just to hear what would be, in the case of England, the country efforts that have been made to improve the working conditions of the early childhood education workforce. If we can talk about this.
Sure.
According to the findings of the report, I may say.
Yeah, well, in the interest of time, I'm also going to assume everybody will read the slide, but let's focus on two main points. First of all, we know that the government introduction of the national minimum wage, which is for the minimum pay per hour for most workers under 25, and the national living wage, which is for workers over 25, have had a tremendous impact in terms of legalizing a minimum wage that was not respected before. And the same is for the pension auto-enrollment scheme, which means that every worker is automatically enrolled into a pension scheme. That has big change in general in England, but because of the low starting conditions of early childhood education workers, had a tremendous impact on that. And the second one, which is not in my slides, but I want to circle back to the role of the unions, because of this divide between workers in the public sector and in the private sectors, it used to be the case that early childhood teachers that did not have a qualified teacher status were not part of unions, but now unions are opening up to every childcare and early childhood education workers. And I think that is a powerful message. It's really powerful for changing perception about the importance of the early childhood workforce. So I think more and more could potentially come out of the work of the unions that they are doing.
Thank you very much, Sarah. I think we could just get close to the final minutes of our webinar, and I will just invite Oliver with the closing reflection from the perspective of the organization where he's working and looking more at the more global but also system level. We know that governments do have competing priorities, and we are still wondering to what extent we are prepared to mobilize our forces to really make the case that it's really worth investing in the workforce, not only in early childhood education, but in the workforce that works in different types of services and sectors. I wonder, Oliver, how we can make a better case to position this category of workforce among the very diverse but also unequitable landscape of professions in the 21st centuries.
Thank you, and thank you for all the fascinating presentations. I think we've addressed a number of issues. The first, as Sarah mentioned, it's great to see that unions are recognizing early childhood development workforce and promoting it. I can also, in reflection to Kennedy's presentation, say that it's been a delight to see the development of ECD and EC in Kenya. A number of years ago, we tried organizing a workshop there, and it was not successful. but I was very recently in Nairobi and saw the support that the teachers union, the KNUT in Kenya is giving to ECE, and this seems to be having an impact with the government, which is starting to take this subject very seriously. It of course helps that, and as one of the questions points out, that there's increasing research that shows that the early interventions make an enormous difference in terms of life quality, but also employability. So I mean, it's a very worthwhile investment, ECD, and I think countries are recognizing that this is going to bring money back if you invest. I think there are other developments that can strengthen this. The care economy in general is getting more and more attention as an employment creator and an employment catalyzer. We're living in a world where there is going to be more and more need for care work. There seems to be an environmental limit to how much we can purchase manufactured goods and how much we should be spending on things like fossil fuels and electronics and so forth. But care work is going to be a growing area. It's where you can create youth employment. It's where you can create women's employment. Investments in care work can create knock-on jobs. So if you invest in healthcare, if you invest in an early childhood education center, it creates demand for catering services. It creates demand for cleaning services, for security services. These kinds of investments are investments in pro-employment. And we've seen, for example, in Western Africa, how some countries have in fact rejected the advice of international lending institutions to reduce public wage bill and said, no, these are precisely the areas where we're going to invest because we expect returns, and especially as the quality improves, it attracts more customers, so to speak. So it's really positive. I really want to acknowledge the fantastic recognition of decent work that the mobile creches are doing. Thank you very much, Niru and Sumitra, for your presentation. I think it would be fascinating if you could share your practices more widely, and also perhaps at some point share the costing model for how you're able to provide services of good quality, but also provide decent work for workers. A lot of employers complain that this is not possible, that this is too expensive, and so forth. But I think sharing these good practices to see how it is indeed financially viable is really, really helpful, and would be a great service, I think, to providers everywhere. Finally, I just, from the government point of view, I think it's great to see that increasingly there's legislation on early childhood development and care workers. These legislative developments are important. They have to be backed up, of course, with promotional and enforcement measures. And one of the institutions we haven't talked about very much is labor inspection. Labor and education inspection play an enormous role here, and I know in ECD it's very difficult because of the wide diversity of providers and the sometimes remote areas. But this is also an institution that has to be strengthened in order to enforce and promote the quality standards that I think we're all supporting. So I'll take this point just to thank everyone for their fascinating contributions, and it's been a real pleasure to participate in this.
It has been a pleasure to have you also together with us, and I want to thank to all our panelists as well, to all our listeners today. The time at our disposal has really come to an end. We are a little bit later than anticipated, and but I would like to thank you and remind everyone that the recording of today's webinar will be available on the website in the next few days. And if you will have any feedback related to the content, please do write to me to the email address that you have now on your desk. Check also, please, our latest country study, which refers to the community health workers and the expansion of the first 1,000 day services in South Africa. It's our latest country study, and very soon we will release the 6 country briefs, among which will be one on the county CIR from Kenya, and 5 other countries that will focus on how specific workforce challenges have been addressed in different contexts and how such experience might be relevant, and hopefully they will be relevant for other countries. We also welcome all of you to sign up for our next webinar later in spring, hopefully when the sun will shed some light on our desks in the offices, and then also to not forget to sign up for our newsletter so that you can learn more about everything we are doing in our initiative, and also when we will have a plan for the next webinar. Stay connected with us on social media, either through Facebook or Twitter. And once again, a big thank you to all of you for the participation today.